and to start the treatment. Open communication should be respectful, non-judgmental and consensual. And we should break down the stigma and misconceptions surrounding the sexual medicine assistance in India. By providing comprehensive sexual education, we can create a more informed and responsible society where individuals can navigate their sexual experiences with confidence and respect for themselves and others. Multicentric studies should evaluate the epidemiology and interventions. Sex education program at school level or people in the community to dispel their myths. Evaluate technology-based intervention in the management of sexual disorders. We should hold more CMEs, conferences, and workshops focusing on sexual medicine, and yes, joint conferences and CMEs like ours for dissemination of knowledge in the field among all the interested professionals are the need of the hour. Thank you so very much for listening patiently.
Awesome, Dr. Nishi. In fact, you were in such a flow, I didn't feel like disturbing you, though you were over time. But thank you so much for giving us such an exhaustive overview of sexual medicine. Well, I also believe that, you know, in the ancient Indian era, we were far more open about talking about sexual issues, and then came Muslim invasion, and then came Victorian era, where women were snubbed, and, you know, everybody stopped talking about these things. Well, thank you so much. May I call upon Dr. Alka to felicitate Dr. Nishi.
Thank you, ma'am.
Yeah, we are open for question answers. Are there any questions? Anyone wants? Okay.
Dr. Alka, would you please felicitate, ma'am?
Sure. I invite Dr. Akhil Agrawal to felicitate Dr. Nishi. Thank you, Dr. Akhil. Dr. Varun. Okay, so this was a very good opening for the day, and here we can very well understand what is going to be ahead for us now. And let us invite our next speaker, Dr. CHIRAG BHANDARI.
This is on. Hello. So our next speaker is Dr. CHIRAG BHANDARI. He has done Masters in General Surgery from MC's Urology, Master in General Surgery. And he has done Fellowship in Andrology from University College London, and Fellowship in Psychosexual Medicine from Mysore, and Fellow in European Committee of Sexual Medicine. So I would like to say,
thank you.
Please start your session.
Good morning, everybody. I am Dr. Chirag, and thank you, Dr. Varun and Dr. Akhil, for giving me such a pleasant opportunity to present on a very taboo topic of penile size. You know, we as sexual medicine practitioners, we often encounter patients who complain of small penis size, or who are worried about their size, or who want an improvement. They are okay with the size, but they just want an enhancement. So I come across a lot of these patients, and there are safe and effective treatment methods for these kind of problems, though they are not recommended by any international association of medications or guidelines. But there are safe and effective methods which doctors have been doing it all around the world, and in India since last 5 years I have been doing, and so far the results have been good. And I would like to give you a gist about what we can do in terms of penis enlargements. So what is penile augmentation? It refers to enhancement of penis size, either length or girth or both, also called as augmentation penoplasty and augmentation phalloplasty. And yeah, there will be some graphic images, so I hope you don't mind if I show these graphic images. It's just for better understanding of what the patients can expect after the treatment. So there are some before and after pictures which I'll be showing later on. So it's also called as augmentation penoplasty or augmentation phalloplasty. Now, how will you justify that you want to do a procedure for penile augmentation. So, socio-cultural aspect, it's been long implied for men to have bigger penises, which was expressed through art, literature, sculptures, or orally passed down. Then psychological aspect is there. Many patients are distressed about their penile size for a long time. They are not confident about themselves, and because of the lack of confidence, they are reluctant to initiate in any sexual activity. And such patients are often depressed, and if they come to you, if clinically the size is normal, you can just counsel them and tell them, the size is absolutely normal and you don't need to worry about it. Most of the patients are relieved with that statement of yours that the size is normal and you don't have to worry about it. But some patients, they are still worried about it, and then they start looking for options to enhance the penile size. So that is a psychological aspect. Then the cosmetic counterpart for females. So females, as we all know, in the plastic surgery, cosmetic surgery, there is breast augmentation, there is hip augmentation, there is Botox, fillers, and all those sort of things for the females, but nothing is there for the males when it comes to cosmetic genital health of the males. So this is a cosmetic counterpart of the female aesthetic surgery, the penile enhancement surgery. And then there is a high medical demand. Every day we get about 50 to 60 queries from across the world for penile augmentation. And India of late has become a very big market for penile augmentation. Because technically, lot of Indian men have, a complex that the size is less. So the inquiries are more, the questions are more, and if the results are effective and if you can provide a safe and effective solution, then I think the patients would definitely agree to whatever you tell them to do. Now, indications: buried penis or excessive suprapubic fat. It is one of the most common indications for penile augmentation. Then small penis due to congenital or acquired disorders like epispadias, hypospadias, penile shortening due to penile cancer, penile trauma, excessive skin loss, prostate cancer treatment, and Peyronie's disease. Extensive plaque can reduce the length of the girth of the penile shaft. So that is another indication for the patient who's worried about his size. You can advise him augmentation. Cosmetic purposes, but all these patients must be thoroughly counseled, and they must undergo a psychological assessment, whether they are suffering from depression or anxiety or dysmorphophobia. So if that is ruled out, then you can try to explain the options for the patients for penis enlargement. So this is a type of surgical penile augmentation. I could not write all these types, so I just took a picture of it from a book. And most commonly which we do is penile girth enhancement. That is the most common and most routinely performed procedure. For the length, as such, there is no effective and proven method. A lot of people are doing suspensory ligament division, but it doesn't really help, according to my experience. And it can also cause contracture of the penis in the later stages. So I don't really do penile lengthening because it doesn't really work. If it works only in the flaccid stage. You have to do a lot of post-operative rehabilitation after that to get the desired result. Now let's talk about girth augmentation. So we have a lot of options for girth augmentation. We have something called as dermofat graft. It consists of all layers of skin and subcutaneous tissues after the removal of the epidermis. The graft is placed between dartos and the buccal fascia. The volume is to be at least 20 to 30% more than the recipient size. Post-operative edema, infection, skin necrosis, seroma, graft absorption can be seen in some cases. Graft resorption is seen in up to 20 to 30% of the cases. it increases both length and girth by 25 and 40% immediate post-operative, and 20 and 10% at the end of 12 to 6 months. But that is the increase only in the flaccid length. So this is a diagrammatic representation of how we do the dermograft, from where we take the dermograft. If you can see the pictures, we can take from the abdomen, we can take from the inner thighs or from the buttocks, and then we can wrap it around the shaft between the dartos and the buccal fascia. Then there is autologous fat transfer girth enhancement, which is basically liposuction of the subcutaneous fat. That this fat you can get it from the abdomen, suprapubic region. When there is excessive suprapubic fat, then liposuction along with insertion of this fat into the layers between the dartos and the buccs can give significant improvement in the existing penile length and girth of the penis. So middle layer is used for injection after centrifugation. So once we get the fat after liposuction, we centrifuge it, and the middle layer is used for insertion into the between the dartos and the buccal fascia. Approximately 30 to 50 cc is injected, and there is an increase in girth by 2 to 3 centimeter. Most commonly, we see nodule formation, fat migration, fat resorption, and the absorption of up to 50% of the fat can occur within 3 to 6 months, but it's actually within 2 to 3 months, not 3 to 6 months. But recent studies and according to the recent experiences, the fat gets absorbed in 2 to 3 months. So this is one of the cases which I did. So this was a liposuction from the suprapubic region and then insertion into the penis shaft between the buccs and the dartos. Another one post-operative and 1 week after the surgery. Now, this is the most commonly done procedure across the world for girth enhancement, which is with the HA filler. HA is hyaluronic acid filler. It is an ideal filling material because it is biocompatible, non-antigenic, non-pyrogenic, non-toxic, non-inflammatory, easy to use, stable after injection, non-migratory, long-lasting, reabsorbable, and natural looking with low complication rate. So HA filler is used ubiquitously in our in cosmetic surgery, in for the face, for the breast, for the hips, for the butt, and it can safely be used for the penis as well. So approximately 15 to 20 cc is injected between the dartos and the buccs again. Back and forth technique or the spiraling technique, both can be done, and you have to make sure that you don't injure the dorsal neurovascular pedicle, so that there is no bleeding and chances of infection are less. After injecting the filler, you use a derma roller to evenly distribute it, and you can expect an increase of about 2 to 4 centimeter in girth and length by about 0.5 to 1.5 centimeter, which is not that significant, but yeah, this is again in the flaccid state. Reabsorption by 50 to 60% at the end of 9 to 18 months depends on the filler. So there are fillers from China, Korea, like Mesoheal. I'll show you the pictures later on. So they last for about a year or 1.5 years. Then there is a filler called as Juvederm, which dermatologists might be knowing. So that lasts for about 2 to 3 years. In studies, like this filler was used for penis augmentation, and in those studies, they claimed that the filler stayed for up to 5 years as well. So this is one of the most commonly done procedures. Very low complication rates. Even if it is there might be a little bit of edema and pain. And yeah, depends on the filler. There can be a nodule formation or not. Usually with the Chinese and Korean fillers, you can expect some nodule to be formed. If the nodule forms, you can inject a hyalase injection and the nodule will disappear. So this is Voluma Juvederm, which is one of the costly fillers and one of the best fillers available for penis enlargements or for other cosmetic purposes. And on the right side, you see Mesoheal, which is from Korea, another popular filler. But in some cases, we have seen nodule formation with this filler, but it doesn't really affect the patient because we can dissolve the nodule by injecting hyaluronidase. So these are few before and after pictures of girth enhancement with HA filler. So this is a short video. This video was shot like 3-4 years back. So it's an old video. So you mark where you have to inject. Basically you divide the penis into 4 quadrants and then you inject in each quadrant. So the needle which I have used here is a 18 number spinal needle, and you can go from the proximal aspect or the distal aspect, and through back and forth technique or spiraling technique you can inject the filler gradually from proximal to distal aspect. Then this is an important step to make sure that the filler is evenly distributed along the shaft of the penis. So here on the right side you can see before and after. Again, few more pictures of enhancement with HA filler. Alright, so now we come to something called as allograft. So there are a lot of patients who come to me and they tell that they want a permanent solution to their small penis size. So for that I usually advise them to go for something called as a allograft, which is basically acellular dermal matrix which is available in sheets. So this is how it looks like, and it is acquired from donated skin using proprietary processing techniques which preserve the biochemical and structural components of the extracellular matrix. It is routinely used for burn wounds, reconstructive surgery like breast reconstruction, hernia repair. In market, it's commonly known by the name of Megaderm, Alloderm, Shorederm,